Does testosterone replacement therapy, TRT, increase one's risk for developing prostate cancer? And the answer, gentlemen, is no. TRT does not increase your risk for getting prostate cancer. The idea that TRT may increase your risk comes from an idea from 1940. And unfortunately, that idea is stuck. And to this day, many providers are hesitant to prescribe TRT to men who need it for this reason. Not only does TRT not increase your risk for developing prostate cancer, but what's interesting is the opposite might be true. And that recent evidence is showing that men with low testosterone have an increased risk for getting prostate cancer. And that treating these men with TRT will decrease their risk. Having low testosterone comes with a number of problems, from increased risk of cancer, metabolic issues, diabetes being one of them, psychological issues like anxiety and depression. It's unfortunate that testosterone and TRT get such a bad reputation.